The federal opposition says a plan to axe the chronic disease dental scheme will weaken the health system in regional Queensland. Across the state, 106,000 people are waiting for public dental work.
The chronic disease dental scheme allocated $1 billion a year for people whose teeth were so bad it affected their health.
Before that, obviously, you paid cash or you went to the public waiting, the government dental clinics, and went onto the waiting lists.
But now the federal government plans to replace it with a $4 billion initiative covering children and adults on low incomes from mid-2014. But the current support ends at the end of the month.
So these poor people with toothaches, breakages, pain and disease are going to be just waiting.
The coalition has launched a disallowance motion calling for the current system to stay in place until the changeover. Ewan Jones says some practices won't be able to wait out the downturn in patient numbers, affecting even those who are able to pay.
If you lose a dentist in those regional centres, you will end up with no dental service.
The Federal Health Department says there were loopholes in the system that meant millionaires could access the service for cosmetic procedures. Dentists want the current program means tested rather than scrapped.
Like any system, it has its strengths and weaknesses, but we shouldn't throw it all out and abolish it purely and simply because it's overrunning its budget.
Amelia Brace, 7 News.